very hard to explain crisis, but my pain crisis comes mostly at night. Usually it's like usually it's the joints in your legs and the muscles. You know, there's excruciating pain. There's this pain that sometimes when you have when I have a normal headache, I can still go about my activities. You can have a headache and do everything else you're supposed to do. When there's crisis in your legs, in your arms or tummy, you it's just pain in your legs, pain in your joints, pain in your tummy, pain everywhere in your body.
It's a Thursday at the Sickle Cell Center of the Akuse Government Hospital in the Eastern Region. A young boy is brought in by his mother. He's having a pain crisis and needs urgent attention. I was told he was writing examinations in school when the pain crisis began. There's a challenge here. His veins cannot be seen to administer drugs to give him instant relief. The nurses attempt again and again and again.
So I'm done. Sorry.
This time, it's rather hit a tissue, and the nurses have to try again.
When someone has sickle cell disease and is in pain crisis, it's like a regular person having your bone twisted. It's very painful. So as healthcare professionals, when we see them in crisis, we know the level or the pain threshold that they experience. So we give them that needed attention that they need for the pain to subside.
It's successful at the 6th attempt.
The child had apparently been in pain since yesterday. So it's fortunate for the child to have showed up today, being a clinic day, and he having crisis. Normally they would wait to see if the pain would subside, then they wouldn't show up. So today being a clinic day, and then coincidentally the child having crisis, they coming in automatically has warranted them for admission.
This is just one of the challenges many people living with sickle cell disease have to go through. Having sickle cell disease means little Festus's veins are not easily visible. At 8 years, Festus is in kindergarten instead of class 3. His mother told us he always gets into pain crisis during examinations, hence his inability to progress to another class.
We spent all our resources on buying blood and medication due to my son Festus having sickle cell disease.
At the Sickle Cell Center, I noticed another student feeling uncomfortable. He's also experiencing a pain crisis and needs urgent relief. Like Festus, he's also writing promotional exams in school and had to be rushed in.
When people have very critical examinations to write, they often undergo a lot of stress, and a lot of them run into crisis.
My mother has AS, and my father also have AS, so when they came together, and I have the SS. I don't play football or those kind of athletics, like high jump and those things. I think they should help the hospitals with drugs, like the way I'm feeling pain in SS. They should look for medicines for those who have SS. Someone like me.
Mayo Clinic defines sickle cell anemia as part of a group of inherited disorders known as sickle cell disease. It affects the shape of the red blood cells which carry oxygen to all parts of the body. Red blood cells are usually round and flexible, moving easily through blood vessels. In sickle cell anemia, some red blood cells are shaped like sickles or crescent moons. These sickle cells also become rigid and sticky, which can slow or block blood flow.
Sickle cell disease is passed down. It's inherited, so that when two parents, each parent has the sickle cell trait, then every time the woman gets pregnant, there's a 1 in 4 chance that the child will have sickle cell disease, and that's with every pregnancy. Where normal red blood cells live for 120 days and move easily, with sickle cell disease, the red blood cells die within about 20 days. When there is a blockage of the blood vessel to where, let's say you have a blockage here, you're going to have pain because there's a lack of oxygen. But the damage occurs in the eyes, in the brain. People can have strokes in the lungs, in the kidney, in the liver, in the bones. And again, it's a very serious disease. People die early.
In Ghana, it is estimated that 17,000 babies born every year have sickle cell disease. Most of the time, the condition goes undiagnosed until age 4 and during a pain crisis. Findings in the study Diagnosis Patterns of Sickle Cell Disease in Ghana, a secondary analysis published in the journal BMC Public Health, revealed across sub-Saharan Africa, 50 to 90% of children die from sickle cell disease-related complications before the age of 5.
My uncle died at the age of 19 years, and when they narrated the whole story to me, I realized it was his lifestyle and our family not having the necessary information on how he ought to live with the disease, and that, I think, is what led to his death. And I also lost a very close friend from sickle cell disease, and I believe if things had gone on the way that they should have gone in terms of education, educating the healthcare professionals who took care of him, my friend would still be alive today. He died at the age of 28 years. And then even for me, a carrier of the sickle cell trait, I found out at a very late stage when I was in the university. My siblings also found out that they were carrier. Then we started the conversations about sickle cell disease in my family, like, Daddy, are you the one who gave it to us? Or it's mommy? And then he was like, oh, it's me. And my brother actually died from sickle cell, and we didn't know. And that's how bad it is. Sickle cell disease can be that close to you in your family, and yet still discussions about it is like very minimal, like zero, until you have someone living with you with a condition.
For most families affected by sickle cell disease, the toll of the disease on their loved ones is significant, with access to innovative treatments one of the major challenges. I'm here at the Bone Marrow Transplantation Ghana and Comprehensive Sickle Cell Foundation Clinic at the Greater Accra Regional Hospital.
Yeah, okay, all right. I told you from my house that by the grace of God, everything will be okay. So you see that you are not feeling any pains. You're not feeling any pains, all right? So the Lord is in control, okay?
Elishiba and her father have traveled 43.4 kilometers from Manfi in the eastern region to the regional capital Accra to access treatment. Her father tells me the toll of having a child with sickle cell anemia is enormous.
She sometimes tells me, Daddy, what's wrong with me? Sometimes I don't want to disclose what is happening to her. Sometimes when she gets into severe pain, she tells me, Daddy, am I going to die? So I'll pray with her. After praying with her, then she'll tell you, okay, I believe I'm okay. Sometimes she'll go to school and I'll be called to come and pick her because she has a crisis. As we are speaking now, they are writing exams. I have to speak to the teachers so that they keep her paper, and then next week she will write it. I think within last 2 months, I have to go and pick her from the school more than 6 times. Yeah, or I should go to the school and complain about stomach pains, chest pains, and sometimes pains in the joints, and that will not let her concentrate. So I have to quickly go and pick her from the school.
Elishiba has to forfeit examinations in school to undergo this important treatment, the automated red blood cell exchange transfusion.
Why is it that I'm different from my other siblings? Because they don't normally get sick. Sometimes they come and put that come and take me from the school whilst we are learning because of the pains.
For many patients living with sickle cell disease in Ghana, going through a pain crisis is not a pleasant experience. Here at the Bone Marrow Transplant Center at the Greater Accra Regional Hospital, little Elishiba is undergoing a blood exchange process in which her abnormal cells are being exchanged with healthy red blood cells. After this process, she undergoing a pain crisis episode will reduce drastically and improve her quality of life. But the big question is, when will this process be available to every child and every person living with sickle cell disease in Ghana? For many years, the main method of treatment for sickle cell anemia was transfusion therapy. By repeated transfusions put patients at risk of iron overload. Now, with the innovative treatment of the automated red cell exchange transfusion, destroyed red blood cells are removed and replaced with healthy new ones simultaneously. This machine is not available at Manfi, where Elishiba and her dad come from. It is in fact the first and only machine in Ghana and in sub-Saharan Africa.
For patients who come in crisis, in severe crisis, it offers them instant relief from pain crisis. Yeah, and then also, as a sickle cell patient, you are at risk for a lot of complications. One of them is stroke. So we've had children as young as 5 years, 4 years, who have had stroke about 3-4 times. Yes, so this procedure relieves you from that risk of having a potential stroke. And also we have a condition called acute chest syndrome, where they have severe pain in the chest and difficulty in breathing. This also helps to relieve you from that.
The cost of the automated red blood cell exchange transfusion process is $3,000, but the Bone Marrow Transplant Ghana and the Comprehensive Sickle Cell Foundation Clinic has subsidized this cost by 60%. This means Elizabeth's father will have to pay 7,000 cedis to undergo this process. Elizabeth's family may have scraped through to get this treatment option, but what about thousands of families in rural communities?
Initially, before we established ours, we had to refer our cases to the Greater Accra Regional Hospital for them to seek those kind of services. But since we established ours here, they are able to come here directly for their medications. And we've had a lot of patients, they are so happy, commending us for establishing the clinic because they had to go to Rage. So you are seen there, then you now have to go and get the medications, and with transportation fares and all that, it was quite difficult for them.
Most of them come and they end up being admitted. Some don't even know much about the condition, so they come through OPD, we assess them, we make them go to the lab to have some investigations done, and that is when we are able to tell. We tell that these children are suffering from sickle cell, and so we communicate to the parents. Some are admitted, and the difficulty is that sometimes they are not able to afford their medications.
Stem cell or bone marrow treatments and most recently gene therapy are the only cure for sickle cell disease, but they are not done very often because of the risk. That's not the only challenge. It is also a matter of affordability.
There are so many disparities in the system with regard to accessibility to such treatment. Gene editing, as you mentioned, is just not a walk on the path. It's a whole complex system, and it requires a lot, and it's quite expensive. And we believe that will probably will not be available for patients for the next probably 20 years to come. Okay, so right now, the bone marrow transplant is the only established cure to this very disease. We are trying to obviously make this very affordable for those who cannot afford. For instance, in US, it's about $600,000. If you go to Europe, where I am, it's about 300,000 euros. UK is about 150 to 200,000. How many of these are people can afford? So we, BMT Ghana, have made it such that we are working around the clock trying to get the price under control. So for instance, we are doing this for about $20,000 to $30,000. Before, when we started, it was even free.
And we have to look for a cure for sickle cell disease which is accessible, affordable, safe for everyone, and it should be a cure that's even accessible in rural communities. The current technology for curing sickle cell disease, we know bone marrow is out of the question for literally almost everyone in Ghana and other parts of Africa because of the cost involved. The majority of people cannot afford bone marrow transplantation. I can't afford it. My colleagues cannot afford it unless you come from a very rich home or you have money from a very rich donor. What we have currently is CRISPR-Cas9, which is a gene editing tool or technique which has been used to cure someone living with sickle cell disease and is still under clinical trial. We also have base editing. I think the news came out just this month of a young girl in the UK who got cured from leukemia, yes, using base editing. And base editing and both CRISPR are very hopeful technologies which can be used for sickle cell disease. The only issue is that these are not accessible. They are not going to be affordable in Africa.
For many parents in rural communities, it will take years to raise this amount of money to cure sickle cell disease, as they even struggle to buy medicines at the pharmacy. Bernice is buying medication for 2 children at the pharmacy, but there's a problem with payments.
72. Unless I wait a while, because the money is not up to.
She has to wait for the money to be sent to purchase the drugs for the children.
I've come for the drugs and I've realized the cost of the drug is high and the money I have on me here is not up to. So unless I wait, either I wait or I return home and get a different money to come for the drugs. And where I'm coming from, so it's very far. So I have no option than to wait for someone else to send me money for the drugs. We are pleading with the government to reduce the cost of the drugs for us, the parents, so that we can be able to pay for it whenever we come to hospital.
The economic and financial burden is huge.
I cannot afford to use all my money to pay for his medication.
Hydroxyurea is a commonly used medicine for patients with sickle cell disease in developed countries. It was approved by the Food and Drugs Authority in 2018 for use in both adults and children in Ghana. Ghana thus became the first country in Africa to commit to offering the global standard of care for people with sickle cell disease. But there are still challenges with access to the life-saving drug.
If the healthcare facility close to you does not have it, then it means that you have to travel a long distance to get hydroxyurea. And unfortunately, we heard some, I think over a month ago, that it's no longer accessible in the facility I'm working at. Hydroxyurea is no longer accessible on the National Health Insurance Scheme, and the patients have to purchase it with their money. And so there are some that, I have some patients that my organization is supporting, so I know we have to support them now out of pocket. But what happens to people who are not being supported by family, friends, or they do not have any organization supporting them? So they will stop their hydroxyurea.
Beyond its public health impacts, sickle cell disease can interfere with many aspects of a patient's life, especially their mental health.
Because I'm aware of my condition, those are some of the questions you start asking when things start getting serious with someone. And so then I had to ask the person of their genotype. And it became aware that she was also a carrier. She was just a carrier. And there was a lot of psychological battle within myself. At a point I thought that it doesn't matter. But I've also come to realize that it's not just about me, it's about the other person. Coming from the rejection through love and stuff like that, it brought back a lot of painful aspects of my life. And I just, in that moment of being rejected, fell to lack of affection from everyone else. And when I felt that, I opted, to not be here anymore. I opted to rather die, because I felt like over there there's no more pain. Over there's no more limping situation. There's no more stunted growth analysis on a person. I just felt like death was a better choice.
Genetic counseling, I think, is very important, because once the child is born with a sickle cell disease, it's too late for you to do anything about it. Then you have to live with it for the rest of your life. So, but I think that those who are yet to marry especially, they should take genetic counseling seriously.
More than 66% of the 120 million people affected worldwide by sickle cell disease live in Africa. In the African region, 38,403 deaths from sickle cell disease were recorded in 2019, a 26% increase from 2000. The World Health Organization Regional Director for Africa says we can no longer ignore the significant burden caused by sickle cell disease. We must do more to improve access to the treatment and care, including counseling and newborn screening, by ensuring that programs are decentralized and integrated with services delivered to communities and at a primary health care level. In August 2022, African health ministers launched a campaign to ramp up awareness, bolster prevention and care to curb the toll of sickle cell disease, one of the most common illnesses in the region, but which receives inadequate attention.
We need the help of government. The process is expensive. If there are health insurance companies, we can come together and see what kind of package can be made available. And lastly, other NGOs that have this kind of sympathetic agenda for people who have this kind of disease condition can also come in.
In terms of introducing something like transplantation, you do need to have an excellent treatment center to take care of the sickle cell disease, aside from an excellent treatment center to care for the person who has to be hospitalized for an amount of time after they've had either the gene therapy or the transplantation. So here, the healthcare infrastructure in West Africa, there is a need for improvement in low resource settings. You have to have that really excellent care in order to be able to support the person to go through a rigorous medical procedure.
For many persons living with sickle cell disease in Africa, they require stronger health systems to ensure quality and uninterrupted services and equitable access to medicines and innovative tools. Indeed, the spotlight must be put on sickle cell disease to help improve the quality of life of those living with it.